Hi, good morning. Thanks for inviting me to speak today, and hopefully my presentation will link in with Malcolm's, building on the kind of aspect around how do we evidence this link between environment and health. My name's Nerys Edmonds. I work for the Wales Health Impact Assessment Support Unit. We're an all-Wales team and we're part of Public Health Wales. Just to say a little bit about our team, what do we offer? We provide tools and guidance on health impact assessment, training and mentoring in both health impact assessment and mental wellbeing impact assessment. We also work a lot in collaboration, and we've been working for a number of years with Natural Resources Wales in the development of tools around measuring and identifying the health impacts of the environment more generally and specific programmes, and we're always interested in new collaborations. So I really want to focus down a little bit on what this sort of evidence challenge is for a lot of community-based conservation and environment programmes, and some of the challenges, and also where I think health impact assessment as a process and a tool can help with some of those challenges. So I'm going to talk about a couple of case studies where we've used health impact assessment on community-based either conservation or gardening programmes. So as Malcolm's already highlighted, there's a lot of high-level evidence around the link between environment and health. And my special interest area is mental well-being, and there's an awful lot of evidence around that. But one of the challenges is the complexity of factors that influence health and well-being. And when you start looking at how do we evaluate for a specific project or even an open space programme, how do we isolate the impact of that particular project or that particular open space change on people's mental well-being or general health and well-being? And also, what type of activity works best for who and where? And all these are things that, to create a good evidence of impact, you have to start to untangle. Malcolm's already mentioned the social determinants of health, and we can see in this picture the range of factors that influence people's health outcomes, from both their kind of age, hereditary factors, through to their community, levels of social support, family relationships, their daily activities, their workplace, and then the environment that they live in. There's a very complex interaction between all these variables, and when you're coming to think about an evaluation for how your particular programme or project might impact on health, you've got to try and disentangle some of these different factors. I found this study really interesting and useful. It's a systematic review of 20 different evaluations of conservation volunteering, and it was carried out by Lovell et al., and they're from Exeter University. And out of the work that they did on their systematic review, they drew this amazing diagram. And I think first thing for me, what this demonstrates is the complexity of what's going on, the different relationships between different factors in a conservation programme where you're getting people involved in volunteering, all these different factors that influence people's well-being and health outcomes that could come from that. So, the sort of things that they're highlighting is that there's a lot of mediating and moderating factors. So what type of environmental change are people involved with? Where is it taking place? Is it near where they live? Is it far away? How do they get there? What are people's expectations when they come on the programme? What type of engagement do they have? What's their own self kind of health status when they come on the programme? For some programmes, you find that they work best for people with much worse health, that they will have a bigger magnitude of change from a programme than maybe people who arrive on a programme with already reasonable health. And also, is the activities on offer the sort of thing that those individuals enjoy? Not everybody wants to go out walking. So there's a lot of different factors, and this can make it a real challenge for individual projects to evaluate their impact. Particularly small projects with limited funding. I know very well that often there isn't a big budget for evaluation that's put into funding bids. A lot of funders don't provide adequate funding for that. Evaluation takes a lot of administration. Sometimes giving people forms to fill in health measures is actually quite disruptive to the kind of engagement process in a project. A lot of projects are very successful at engaging quite isolated individuals, and actually the interpersonal relationship's really important. But if you start giving people long forms to say, can you fill in this 20-item questionnaire on your physical and mental health, that can actually be a barrier to engagement. So there's a lot of challenges for projects. in terms of how to evaluate these impacts. What this systematic review that Lovell and colleagues did was they reviewed 20 studies. They basically found that a majority of the evidence was poor quality, and a lot of this was because they were quite small-scale studies, self-selecting samples, and the outcome measures weren't necessarily sensitive enough to measure impact. So when they looked at 10 quantitative studies, the findings were inconclusive of benefit to health and well-being, but the qualitative evidence very much found that people reported that these activities had value for their health and well-being, and this was through a number of key mechanisms. One of the conclusions of this systematic review is that most of the evidence at the moment for that kind of programme is insufficient to show any causal link, and that one of the difficulties was that the majority relied on self-report, and that the measures that were being used weren't necessarily sensitive enough to detect change from what might be quite a limited engagement with the project and quite sort of transient engagement. So that wasn't necessarily to say there wasn't any benefit, it's just that the measures that are being used aren't necessarily the right ones to detect the changes and the benefits that are happening. What the authors go on to say is that, there's very strong evidence about these mechanisms through which environmental conservation programmes benefit people's health. So physical activity, exposure to the natural environment, having a sense of achievement and making contribution, enjoying the activity and social contact. So we know there's very strong evidence that these things benefit people's health and well-being. And I'd just like to highlight, social contact. Social isolation is being much widely recognised now as a key health a public health problem. And there's a lot stronger evidence about the impact of social isolation on mortality. So I would say that, if you're benefiting people's social networks and reducing isolation, you're having a health impact. And I think it would be good to really focus in on that, because a lot of these programmes have a real strength in that area. So some of the conclusions from that element are, when you're thinking about how to evaluate and measure how you benefit people's health and well-being, it's important to think about who are you working with, who do you reach? Are you going for a particular target group, and are they people who are likely to benefit from that particular intervention? What's most important for the people that come to any activities? And what's the key mechanisms that the programme benefits health? Is it through social contact? Is it through a sense of achievement? And if it is through a sense of achievement, how can you maximise that? How do you maximise that sense of achievement in your programme? What's the realistic, valid and acceptable ways of measuring these? If you've got a client group who really don't like paperwork, it's going to be a real struggle for you to use some of the instruments that are used for measuring kind of technical health outcomes. And are the measures sensitive enough to measure change? How are you going to use the evidence you're gathering, and who is it for? I think it's really good to think about your audience, because sometimes I've been involved in health improvement programmes where we've gathered like this many forms, but we weren't really using that evidence for anything. So I think it's really important to think carefully. So this brings me on to health impact assessment, because I think health impact assessment is a useful tool to grapple with some of these issues for environment programmes. And this is the classic definition of health impact assessment. It's a combination of procedures and methods by which a policy, programme or project may be judged as to its potential effects on the health of a population and the distribution of those effects. So we're interested both in what the impacts are, but who is impacted, and what does that mean for health inequalities and people who may suffer poorer health. The other thing just to mention is that you can use health impact assessment on a wide range of projects and policies. So we also use health impact assessment on things like local development plans, special supplementary planning guidance on open spaces, a number of kind of urban open space projects. So though I'm talking about sort of mostly conservation volunteering today, it's a flexible tool. So some of what elements of health impact assessment, it can be used either at the prospective, concurrent or retrospective phases. What this means is that you can use it in the design of your project in advance to think about how can we really maximise our opportunity with this project to impact on health. So it can help with project design and planning. It can help you review a pilot and think about what's our learning around health and wellbeing and how can we strengthen for future. And it can help with designing your evaluation and as part of your evaluation. And it also helps bring a focus on who benefits, who are you working with, what does that mean in terms of health impact, who aren't you reaching, who does your programme work best for. Some of the benefits are it identifies positive impacts, but also what we'd call unintended consequences. All projects can have their downsides, and it's quite useful to identify that. It's systematic and it's practical. I think that's really important. It also is scalable to a range of projects. It's evidence-based, it's participatory, so it involves people, it involves both your beneficiaries but also your stakeholders and partners. It can help you improve implementation. Crucially for me, going back to those mechanisms, it can help identify those mechanisms for actually how is your project improving health. So maybe before you start thinking about your evaluation, think about how is your project improving health to begin with. And it can help identify indicators if you want to do a social return on investment or a more in-depth evaluation study. It can help you target what evaluation measures to use. So I'm going to move on now and talk about a couple of case studies where we've worked with programmes to use health impact assessment. And the first one is Active Woods, and I know Amy is going to talk about the programme itself after me, so I'm not going to go into any detail. But a lot of you will be aware of the Active Woods programme anyway. This kind of goes back to the scalability of HIA. We carried out an initial assessment, so it's a desktop assessment with the staff team. And this was in 2015 when the project was undergoing a review and thinking about how best to evaluate the programme. And we just worked with the staff in this particular piece of work. It was a short workshop, and it was about exploring from their experience how was the project impacting on health and wellbeing. And it built on the work that we were doing at the time, which was part of a pilot with Natural Resources Wales to develop a health and wellbeing impact assessment tool for the environment sector. And what we found just from talking to the staff was that people identified positive impacts around lifestyle, physical activity, reducing social isolation. People felt more positive about their local area because they discovered new woodlands. Also, the intergenerational working was very positive. There were improvements made to the living environment. In terms of mental well-being, people had a strong sense of control over the activities. It improved people's emotional resilience. People had the opportunity to take notice of nature, and there's a lot of emphasis now on mindfulness, and very much these nature-based activities gave people an opportunity to be peaceful and observe nature. But it also helped with economic conditions for health in terms of giving people new skills, learning and volunteering opportunity, and the confidence for some people to return to employment. And I'm sure these are benefits that many of you have seen in your programmes. In terms of who was it benefiting, there were a wide range of people benefiting, but there were particularly quite a lot of groups who, from a public health perspective, are at risk of high levels of poor health, and so for us are really key groups to that we're looking for how can we engage these populations, particularly I think around sort of middle-aged men. From a public health perspective, they're a key target group in terms of suicide prevention, and I think for some that was kind of maybe a new way of looking at their population for the project. So some of the benefits of that for the project, for the Active Woods project, is that it got the project thinking in terms of the evaluation beyond tick boxes. That was what the evaluation manager said. It helped the team identify the groups they were working with. It developed a greater sense of understanding of their health impact and the sort of breadth of social determinants of health that their project was impacting on. And it provided some information to support future funding applications. So that was one case study. The next one I want to talk about is Swansea Community Farm. And again, we were looking at some collaboration when we worked with the farm, and we'd approached the Federation of City Farms and Community Gardens to say, maybe health impact assessment would be a useful tool for them. And Swansea Community Farm was our first project. In this instance, we did a full health impact assessment. So this involved a range of evidence, including a workshop with their volunteers to talk to them about how it had impacted on their health, a participatory workshop with stakeholders and partners. We did a literature and evidence review, and we also did a profile of their participants. Again, lots of positive impacts identified. you'll see a lot of close relationship with the Active Woods programme, so physical activity, reducing isolation, meeting new people. Improved relationships at home was an interesting one, because some of the people who were accessing the farm had been suffering from quite severe depression. As their depression and well-being improved, their relationships at home began to improve as well. Again, impacts on the living environment and being outside. Mental well-being was the major impact area. Lots of impacts here about self-belief, achievement, producing something tangible. And if you think back to the mechanisms we identified earlier, that sense of achievement is really important to people. Self-confidence, a sense of belonging and feel part of the team, feeling valued, and feeling involved and included. And again, some economic, what we would broadly say was economic impacts in terms of improving skills and confidence to maybe return to work or other education. These are some of the quotes that volunteers gave, and you can see here, again, some of these links with some of those mechanisms that I identified earlier. You know, people saying, I can see the end product, and I feel that I'm worth something because I'm contributing to this. Another volunteer said it gave him a role in society. He's not just broken and on the scrap heap. The other interesting one here, in terms of sort of social contact and the bonding and relationships that form, is that people said it's easier to talk and share their experiences in a non-threatening environment. So this environment of working alongside each other, doing practical work, particularly for our male volunteers, really enabled them to start to share, to open up with each other about some of the challenges they were facing. And I think it's really important, because in the health sector, we really struggle to engage men in mental health services early enough to get help. And I think there's something really powerful about this kind of practical volunteering, people working together, can give them that opportunity to open up and just very gently get to know each other and support each other in a kind of this non-threatening environment. Again, very similar kind of population group that the farm was attracting in terms of volunteering, but all people who are vulnerable to high levels of poor physical and mental health. And again, I'm highlighting that group around suicide prevention, I just think is really important. So some of the benefits of health impact assessment, I haven't been able to go into the detail of how we do it today, but I'm happy to talk to you about that later. Some of the benefits of the health impact assessment for the farm provided helpful evidence for funding, provided evidence of engagement with stakeholders and volunteers. It helped the farm understand what was most important for the volunteers about coming. Again, provided that insight into the actual mechanisms through which the farm was helping people's health. We identified the major impact was mental well-being. The farm reaches people that other services struggle to reach. It helped develop a new project focused on peer support and mental well-being, and it improved communication. So there's lots of these very common themes across both projects, and again, that's very much reflected in the systematic review by Lovell that I showed you earlier. So we know there's some really strong mechanisms through which these programmes improve health. And for both of the projects, we have identified a very strong link with what's called the 5 Ways to Wellbeing that were developed by the New Economics Foundation. So just a sort of conclusion really, what can health impact assessment offer to environment programmes? In advance, so in prospectively, it can help integrate health and wellbeing into the design of programmes, and that's whether it's a sort of volunteering programme or whether it's a kind of environmental improvement programme that's more about a large open space or a small open space even. It can help you plan to maximise your impact and improve implementation. It can help you design an evaluation that actually measures the mechanism that you're improving health through. Provides evidence of engagement, can provide evidence of impact, so if you're then using it retrospectively as an evaluation, it can give you qualitative and quantitative evidence. It can help you develop that theory of change for how your project's improving health and how you're contributing to specific local health priorities, and I think that was something that was really important for both projects that came out of the health impact assessment. And it can improve and measure impact. I just want to mention, as well as the generic health impact assessment tool, that where we do cover mental health, There's also a tool called Mental Wellbeing Impact Assessment that I've been involved in the development and writing of, that focuses in detail on measuring impact on mental well-being, and this is broken down by 3 key protective factors for mental well-being, which is about enhancing control, building resilience and community assets, and participation and inclusion. And I know a lot of projects are very interested in their impact on mental health and well-being. I'm trying to explore at the minute whether there's a potential for a future collaboration around maybe some piloting of using the tool in Wales with the environment sector. So if anyone's interested in that, please let me know. Thanks very much.